The chief researcher was Dr. Russell Monroe, now head of the psychiatry department at the University of Maryland. These are various progress reports written by Dr. Monroe and recently obtained by ABC News. From one of the progress reports, a report of a woman who had electrodes implanted in the brain and was then given LSD and other drugs. She became agitated, cried, lapsed into a trance-like state. Felt as if she were about to have a convulsion, experienced waves of darkness and light, had bizarre sensations in her neck and legs, said somebody was trying to manipulate her body. At this point, Dr. Monroe wrote that the woman was obviously having paranoid ideas. As a layperson, perhaps you can enlighten me. What therapeutic effect would the type of experiment that I just described have on a patient?
Well, the therapeutic effect would be indirect.
Was this patient aware that she was being given LSD?
Yes, I mean, they were told that they would be given some medication, and they
specifically LSD?
Well, we told them, I don't think that they would have even known what LSD was then at the time. They were told that they were going to they would be given some medications which might make them feel worse.
Dr. Monroe, what do you think the Army Chemical Corps was looking for in all of this testing?
They were looking for an incapacitating agent, an agent that would not harm the person permanently, but would incapacitate them temporarily. That seemed like a humanistic way to wage a war, if war is necessary.
When James Thornwell was given LSD by Army intelligence in 1961, this time it was no experiment. This time the express purpose was to peel back Thornwell's brain to bear any secret within it. This time the Army had gone operational. Thornwell, as reported on ABC last January, was an Army private stationed in Orléans, France. Classified documents were missing from his unit. Thornwell became a suspect. His 2.5-month interrogation included administration of sodium pentothal, hypnosis, isolation, and deprivation of sleep. Army documents obtained by ABC News refer to this interrogation as conventional. Despite this severe questioning, Army intelligence was getting nowhere with Thornwell, and it was decided to slip him LSD. For 16 years, Thornwell never knew what had hit him. Tell me about the acid.
I'd rather not. It's a bad trip. It's a bad trip. That was a bad trip. The pain was so excruciating. Felt like somebody was sticking me with 1,000,000 pins. You know, just everywhere. Oh, it just... Oh.
Do you want to stop for a minute?
I walked around.
You want to stop?
Oh, I can talk. I lived through it. I lived through it. I lived through it.
No charges were ever brought by the Army against Thornwell. He was discharged for psychological disorders. But an Army psychiatric evaluation of Thornwell obtained by ABC News, one which was done prior to Thornwell having been given LSD, says of him, fairly cooperative, oriented, alert, and gave no evidence of psychosis or depression. From the Army's point of view, this type of LSD interrogation was a success. Other documents refer to the exploitability of interrogation subjects, cracking them, keeping them off balance mentally, and providing an economical, speedy, and productive aid to interrogation. From James Thornwell's point of view, it was no success. Thornwell still has serious problems. He's run through 2 marriages. He maintains he can't hold a job, can't concentrate, has nightmares, and feels socially and emotionally isolated. Last fall, Thornwell filed suit against the government in federal court. In a moment, we will examine the closest experimentation to brainwashing that we have uncovered. By far, the most chilling experiments we have uncovered took place at this Gothic estate called Ravenscrag, halfway up Mount Royal in Montreal. It houses the Allen Memorial Institute of Psychiatry of McGill University. It was here that the CIA funded a series of experiments, severe experiments. The work was done by the Institute's then director, Dr. Ewen Cameron. It is the closest experimentation to brainwashing yet disclosed. His work, unprecedented in psychiatry, consisted of 3 areas which he called sleep therapy, psychic driving, and the ultimate depatterning. Dr. Maurice Dongier, current head of the Allen Memorial Institute.
In his psychic driving, so-called type of therapy, he would give the patient intensive electric treatment in order to make the patient regress deeply, become forgetful, and then he would attempt to implant new ideas in the mind of the patient.
Now, to a layman, it would appear that Dr. Cameron was trying to take the slate and wipe it clean, the slate being the mind. In other words, brainwashing.
Exactly, that's a very good comparison.
Brainwashing.
Yes, if you like.
Val Orlico of Winnipeg, Canada, the wife of a member of the Canadian Parliament, was a patient of Dr. Cameron's. She entered the Allen Memorial Institute because of severe depression. She describes for the first time publicly the LSD therapy and psychic driving treatment that she was given by Dr. Cameron.
And then the drug began to take hold very rapidly because it was an IV injection. And things became very furry and very frightening, and had a lot of sensations that it's very difficult to recall. Nobody explained it to me. Nobody ever asked me if I was willing to do it or anything.
He had this feeling that he would be able to get through the resistance of illness and to reach deep changes very quickly.
Did he?
I don't think that when you look at that in retrospect, the hopes that he had have been in any way fulfilled.
But Cameron would plunge on. The next step was what he called psychic driving. This involved almost endless tape-recorded messages and more drugs for the patient. Cameron wrote that this was the way to make direct controlled changes in personality.
I thought this was the coldest and most impersonal treatment that anybody could give to anybody in the world. And I became more and more despondent and more angry. I just became so despondent that I thought I can't live like this any longer. And I thought I would just go out and throw myself underneath the cars on McGregor. I stood on the curb of that street and I stood there and I thought, okay, go. Okay, go. And then I thought, what if you're not killed? What if you're just maimed? What if you don't die and you live and you can't even talk anymore? And I couldn't do it.
The most severe technique Cameron used was depatterning. He described it as breaking up the existing patterns of behavior by means of intensive electroshock therapy with prolonged periods of sleep. He carried out these experiments in something he called the sleep rooms.
People in there were like babies. They cried and they were very disoriented. And we were very afraid of the sleep room. We used to walk very carefully against the side of the corridor that was opposite the sleep room with our backs to the wall when we'd go by.
Cameron used this combined sleep electroshock treatment on patients as long as 30 days. One patient he kept asleep for 65 days. Cameron retired, and his successor, Dr. Robert Cleghorn, ordered a follow-up study on the patients treated with Cameron's depatterning method.
Showed that it was no more beneficial in its result than the use of more conservative methods.
But the follow-up study showed that 60% of those who had been depatterned still had amnesia for periods of anywhere from 6 months to 10 years. That's quite a memory loss, isn't it?
That is a memory loss. Indeed it is. It's more, I think, more than desirable.